All right, so I'm gonna do contractile palpations for the tissue around the hip. So first, I'm gonna find the gluteus maximus, and in order to do that, I'm gonna find the bony structures first. So the main one that is protruding is the PSIS, which is right here on my partner. And then I'm gonna kind of move a little bit laterally with my thumb here along the ridge of the iliac crest, which is right here. And I'm gonna just move inferior until I get on this big muscle belly of the gluteus maximus. And so I start up top here, which is more the anterior fibers of the gluteus maximus. Start rolling my fingers down, bring my fingers down a little bit. Here's the middle of the muscle belly. Let me get down here a little bit lower, and now we're at the more inferior part, and they come to attach onto the gluteal tuberosity on the femur. So gluteus maximus is kind of hard to miss, but kind of to confirm that we're on the gluteus maximus, just in case, I'm going to have my community partner here just perform a quick little straight leg raise, but posteriorly. So go ahead and lift it for me. Contract. Good job. Now bring it back down. So I could feel the gluteus maximus contracting when she extended her hip. So that kind of tells me that I'm on the gluteus maximus. Okay. Now I'm going to find the next one, which is posterior, which is going to be the piriformis. So again, I'm going to find that PSIS, which is right around here on my partner. And I'm going to kind of eyeball where that greater trochanter is of the femur. So it's right around here. I'm going to eyeball it. And I'm going to kind of draw a line here with my finger, or with my hand here. And then I'm going to kind of come a little bit. I'm going to kind of find the middle of where my line is. And I'm going to move a little bit posterior and medial to the PSIS until I'm right on that muscle belly of the piriformis, but it's hard for me to feel it. So I'm going to bring my elbow in here so I can get a little deeper. Let me know if you feel any pain when I'm doing this, okay?
Okay.
And I'm trying to feel so I can kind of feel the glute max right here. Trying to just rub superiorly to inferiorly until I can kind of feel that drop off to where I can feel that piriformis, which I think I'm actually kind of on it right now. And to confirm that, I'm going to have her bend her knee real quick for me, bend her here. And then I'm going to have her go into a bit of external rotation, so bring your leg this way. Perfect. And there we go. All right, bring it back. All right, try one more time. Perfect. So I can feel the piriformis right here pretty prominently. Right here, my elbow is the muscle belly of the piriformis, that was kind of hard to find. It's deep, but yeah, it's right here. And then for the last one, I'm gonna find the gluteus medius. So let me have you lay on your right side for me. I'm gonna come around the other side. Okay, so you can come around this side. So I'm gonna find the PSIS again, which is right around here, right here. And then to find the gluteus medius, I'm gonna just run my fingers up the crest here, which is right here. And once I kind of find that crest, I'm gonna bring my fingers inferiorly to it until I can kind of appreciate this muscle belly right here, which is the gluteus medius. And to confirm that it's the gluteus medius, I'm going to have my partner here perform a side leg raise for me. So go ahead and perform it. Now hold it right there for me. Good, and I can feel that contraction. So bring it back down one more time. I'll go for it one more time for me. Good, and I can feel that contraction, pretty strong contraction right here, which is the gluteus medius. Bring it back down. Good job. So those are the contractile palpations. Let me do a couple of strength tests on my community partner here. So I'm going to have you sit on the edge of the table here with your legs hanging off. And first I'm going to start with manual muscle test of the hip flexors. So in order to do this, we're going to do the right side. So for this test, it's really important that you kind of put your hands behind your shoulders here just to kind of help stabilize you. But make sure you're not grabbing the table. Because if you're grabbing the table, it's going to, you're going to use that to substitute some of the muscle strength here. Okay, and make sure you lean back a little bit. Good job. Perfect. That's too much. All right, right there's good. Okay, so I'm going to use this hand to stabilize proximally, and this hand is going to come up to here. So before I even do this, I want to see if you can move it up against gravity on your own. So real quick, keep this bent the whole time, and then just bring your thigh up to the ceiling. Good. All right, bring it back down. Okay. So again, I'm going to have you sit in this position right here. Okay. Is that all right? Mm-hmm. Okay. And a little bit higher. Perfect. I'm going to apply some pressure here, and I want you to hold it and don't let me move you. Okay. So when on 3, I'm going to start saying hold. I want you to make sure that you don't let me move you. Okay. Ready? All right. So 1, 2, 3. Hold. Hold. So try to break it around my second hold, which is my moderate resistance. So I would give her a 4 for the manual muscle test. And then for the last strength test, I'm going to do a handheld dynamometry test on her right hip external rotators. So for this next test, scooch over a little corner. Thanks. So we're going to be on her right side here, and for this test, I'm going to have you flex your knee a little more. There you go, perfect. Okay, so let's move this over, kind of out to the side. Is that comfortable? Mm-hmm. Okay. So I'm going to get down on one knee here. A little closer, a little bit more personal, and I'm going to put my elbow like into the trunk of my body so that it's harder for her to move me. So this needs to stay stable the whole time. Okay, and so like the last test, I was the one that was kind of trying to move you. This one, you're gonna try to move me. Okay, so I'm gonna hold this right here. I'm gonna find her medial malleolus, gonna move the pad a little bit above it so I can reproduce the test, and then I'm gonna help kind of stabilize right here, just so I can make sure that we're really getting that contraction. So before I even start that, real quick, just kind of slowly start to move this in on your own. Ready? Good. All right, now bring it back. Good. Okay. Malleolus, pad, ready?
Ready.
All right, let me get my grab my testing stuff here. So I'm going to count down from 3 to 1, and then I want you to try to push in as much as you can on this. Okay, so first I want you to hold it like this. All right, ready? Okay. 3, 2, 1. Push, 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 push. Good. All right, we're going to do 2 more tests. Okay. So again, ready? Let's start slowly and then gradually get a little stronger. Okay, ready? 3, 2, 1. Push, 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 push. Good. Okay, ready? One more. One more time. All right, ready? Okay. 3, 2, 1. Push, 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 push. Good. All right, and so the peak forces that I got for her on my handheld dynamometry muscle test was her peak force. For the first one was 7.3 pounds. The second trial, her peak force was 8.3 pounds, and then her third one was 7.24 pounds. So that's around the 5% like error. And then here's the graph. I don't know if you can see the graph, but there's her graph over time. So that was palpations of the contractile tissues, manual muscle test of hip flexion, and then handheld dynamometry of the hip external rotators.